Hello and welcome to our Gold participants from around the world. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for Gold Learning. I have the pleasure of sitting down and chatting with Debbie Albert today, who's going to be presenting at our upcoming conference, the Gold Lactation Online Conference 2017, and she's going to be presenting on Raynaud's symptoms, diagnosis, and treatment. Welcome, Debbie. Debbie, it's great to have you here today.
Thank you, Fiona.
Well, I'm very excited about your topic. It's one of those things that I still feel, after all these years, that's not well explained, and it still seems that we run into it. And I think that sometimes I feel like it always changes a little bit. So I know that when I hear your presentation, I'm hoping that it helps organize some of that for me. And of course, looking at the title there, it looks like we're going to be learning some more things too, about some treatments. But first of all, I'd love to just have you introduce yourself to our listening audience today. And why don't you tell them why you became interested in this particular topic?
Thank you, Fiona. I'm really glad that you asked. When I started working with a number of patients in private practice, I found that there were times when a thrush diagnosis occurred and then everybody was not getting any better. We also had a number of mothers who just seemed to be very upset, even with latch, where you would have a case where a mom would put the baby to breast and even before the baby got to breast, she would flinch, and so the pain level in Raynaud's tends to be fairly high. We have a lot of mothers who seem to be almost hypersensitive, and so I became very interested in this topic because I knew that they weren't making this up. And I think sometimes that people look at clients or patients and say, oh, come on, it can't be that painful. And if you're feeling that way about a patient, then chances are you should suspect Raynaud's.
Wow, yeah, it
Yeah.
just seems,
So I
yeah,
became
it's
interested.
yeah, that's wonderful. Well, I'm glad to hear that. I too have, it's just been very interesting to see I feel like the lack of information that has been out there, and yet this is something that has, probably impacted women for forever, but it still seems today that we're still running into areas where, especially when I feel like I'm collaborating or asking other lactation consultants in my area, we're sometimes drawing a blank on what's happening. So, but it's great to hear how you started on this journey. When you were putting together this presentation, Debbie, can you perhaps elaborate a little bit on what you found to be the most important factor surrounding this topic, or what really stood out to you as being interesting as well?
Well, what stood out to me automatically was this strong desire for most medical practitioners to stay with their diagnosis, which may not be correct. And so we have a patient or a client who is suffering, continuing to suffer, may actually have the symptoms exacerbated by the treatment, and then there's no outcome for the patient or very little outcome for the patient. So this is one of those topics that really requires someone to think outside the box, to recognize that it's much more of a problem than people may realize, that it's fairly pervasive in our population,
Mhm.
and that it's something that we can't really choose to ignore.
Right. Yeah. I have another question for you, Debbie, if you don't mind me asking you, because I'm just thinking about a recent case that I was working with a mom and post-birth, and she, we had discussed this. She had described the symptoms. It looked like, that's what it was. We were trying to determine it, and I had, said to her, go back and talk to your midwife. So what was very interesting, and this I found fascinating, was that the midwife didn't seem to know very much about it, and so she then sent her off to her obstetrician, who then said that it was fine and that it was normal to have sore nipples in the first couple of weeks of life, and so post birth. So my question really to you is, are you seeing this information in being taken by other healthcare professionals and utilized, or do you still feel like there is sort of this misunderstanding about the whole treatment in other didactics, not just lactation consultants, but other areas as well?
It's a mixture of both. And a lot of it is advocating for the patient or the client. In my case, it's a patient because I'm in a hospital. But really communicating with the person or the general practitioner or the OB that that person has to deal with. And I don't mind providing additional education or communicating about why I'm seeing what I'm seeing, and hoping that the person who has to treat the patient is on board.
Right.
That's typically one of the problems I run into. Will they be on board or not?
Right.
And sometimes they're not.
No, no. And I guess it is about
Yeah,
that. It goes back to the consumer, to your patients, clients, educating them, providing them the information, and then, getting them to advocate for themselves, like you said. So, yeah, that's great. And sometimes that's what happens
correct.
in the field before something really changes, I feel. It's one of those things that we often see. So,
It's part of our scope of practice. I
yeah,
mean, we run into, obviously we see, as an example, ankyloglossia. We discuss that with the physician, but we have some physicians who are excellent and will follow up and say, yes, I think I can agree with you on this. And we have others who say that they don't see what I'm talking about.
right.
So,
Yeah,
on a positive note, in my area, I feel that I have a lot of positive reception, and
right.
am able to practice without feeling like I cannot practice the way I would choose to. But I do understand, living in other areas, what it was like to deal with practitioners, and I still have them every once in a while here who are not necessarily going along with my perspective.
Right, right. No, I think this is gonna be a great conversation for us to have, with the delegates. I think this is really going to be powerful because not only does this topic, you don't see it very often explained again or covered. It is in our literature, but I don't feel like there's a lot of discussion. So I'm really looking forward to hearing, you talk with the delegates and get into a great conversation about this, and of course, with the presentation as well. So lastly, before I let you go, Debbie, why don't you share with us what you're most excited about sharing with the delegates and what you're hoping they'll take away from this presentation?
What I'm most excited about doing is giving them another way to look at nipple pain,
Mhm.
to recognize that every time someone has sharp shooting pains, that's not thrush,
Right,
not always. To be able to really discern the difference between the types of pain that people are experiencing and how to help their patient in a more effective way. And I really look forward to engaging with a number of the delegates on this topic, because I feel that it's not, like you said, it's maybe a paragraph in what we've read or something like that. It's kind of to compare it, it's a lot like what we're dealing with when we look at the breastfeeding education that most medical professionals get.
right.
So I would like to see a little bit more in the area. I would like to see more research, and I would definitely like the topic to come up more frequently, and that's one of the reasons why I'm covering it.
Excellent. Well, that sounds great. Well, thank you so much for sharing that with us today, Debbie. We'll look forward to hearing your full presentation at our Gold Lactation Online Conference. I'm excited to have you present. And for a listening audience, don't forget to join us. I see that Debbie is going to be speaking on Tuesday, the 11th of April. And we'll look forward. Check the website though for your local time. You can go onto our website at www.goldlactation.com and you can look at the schedule on there to see what time it's going to be in your time zone. Well, thanks, Debbie, for joining us today. It's been great chatting with you.
Thank you, Fiona. It's been a pleasure.
And also to our listening audience, thank you again for joining us, and we'll have you all back again. Bye bye for now.